Morphology study for early prediction of Bleb failure. The basic careful slit lamp evaluation of post-trabeculectomy Bleb morphology can predict in a reasonable way whether the Bleb is going to be functional, enabling early steps to maintain the target intraocular pressure and prevent disease progression. Everywhere the AIOCT is not available, so at least a basic slit lamp evaluation can predict the Bleb function. This is the purpose of this study. Only 10 trabeculectomies are done by standard technique without anti-metabolite, and patients were followed up day 1, first week, and 4th week, 3rd month and 6th month post-operatively. And key considerations were the Bleb height, Bleb extent and the vascularity of the Bleb. Coming to the first day Bleb, it's a functional Bleb in the left side with well-formed cystic Bleb and normal conjunctival vascularization. This was followed for 6 months regularly, and it was a functional Bleb. From the first day appearance, this can show whether the Bleb is going to be functional or not. And the right side, the Bleb was flat because it was flat, and after digital message also it was not well forming. And this Bleb, early intervention was done, but at the end of 6 months this Bleb failed. And in the left side, this Bleb was after 1 week. This was a cystic diffuse area Bleb, and with normal conjunctival vascularization and posteriorly draining Bleb. This Bleb, without any medication, this maintained its intraocular pressure after 6 months also. This is a nice Bleb. And in the right side, the Bleb on the first week post-op, it was a flat vascularized Bleb. This Bleb failed with intervention also after 6 months. And after 4 weeks, this is a Bleb, which is a wide cystic area Bleb with normal conjunctival vascularization draining posteriorly. This is a nice Bleb, and this maintained without any medication after 1 year also. This was right in the right side. This Bleb was flat and vascularized Bleb. This is a failing Bleb after intervention also. And in the left side, after 3 months post-op period, this is a nicely formed avascular cystic posteriorly draining Bleb. And in the right side, this Bleb was encapsulated cystic Bleb, but and vascularized, so much of vascularization. This is sign of failure. And this Bleb after 6 months, this is avascular cystic Bleb and microcysts are well formed, which is in, and this is a functioning Bleb. And in the right side, the Bleb was encysted with a demarcation line and with conjunctival vascularization. This is a failing Bleb. So this Bleb was graded accordingly Indiana Bleb appearance gradation system, and accordingly one can know in a very quick way whether the Bleb is going to fail or not. So to conclude, the excessive vascularization, flat thick walled Blebs and encysted Blebs with demarcation lines were very early signs that this Bleb is going to fail. So intervention is required in an early stage so that the Bleb function can be maintained. And this problem is not very uncommon. Post-operatively trabeculectomy Bleb failure is commonly encountered situation for all glaucoma surgeons. It might be due to various reasons starting from preoperative, intraoperative and post-operative causes, and careful examination and proper documentation at each follow-up visit by a basic slit lamp examination, if the higher instruments are not available, can predict whether the Bleb is going to fail or not, so that early steps can be taken to maintain the target intraocular function and to preserve the visual function. Thank you so much for your attention.
Thank you, Dr. Rita. That was an excellent presentation. I just wanted to ask, were all the surgeries titrated in the same way? Did you use the same mitomycin? Did you use them for the same period of time?
It was without antimetabolite, single surgeon, and in the same way, 1 apex suture and 2 side sutures, and only titration.
So,
after titration.
Okay. All right.
Only titration.
Thank you so much.
Welcome.
Thank you for keeping to the time. And I also had a question that do you, you are not at all discussing the intervention, like if you found that a Bleb was not good right on the day 1,
Yeah.
then what did you do? Because did that help? Because some patients...
Yeah, purpose was that why we are studying the morphology, because of time constraint, I have not mentioned all those things. In the first day slide I showed in the right side, the blade was flat. We gave the digital massage. If the digital massage it was forming, then it's well and good, we are waiting. If it's not forming, then we are going for a suture lysis. Intervention was done.
Okay, thank you.